private hospital room charges could soon face a major change. A parliamentary panel has recommended that private hospitals in large metropolitan cities should not charge more for a room than the average tariff of a 3-star hotel in the same area. The proposal is aimed at bringing down hospital bills and making healthcare pricing more transparent. But this is a recommendation, not a rule yet. The recommendation comes from the Parliamentary Committee on Health and Family Welfare, which has been examining the affordability and accessibility of healthcare in India. The committee says that hospital room charges vary sharply, not just between cities, but even between hospitals located in the same area. Its solution is to create a simple benchmark. For private hospitals in large metropolitan cities, the maximum room charge should be linked to the average tariff of a 3-star hotel in the surrounding areas. The panel does say that hospitals could still add reasonable cost for things such as resident doctors, nursing, consumables, meals, and laundry when calculating the overall bill. The committee has pointed to a significant gap between hospital room rates and hotel tariffs. For example, at Nanavati Max Hospital in Mumbai, a single private room was cited at around 6,000 rupees to 12,000 rupees per day. Nearby 3-star hotels, according to the report, charged around 2,500 to 4,500 rupees a night. In Delhi, Saket, private rooms at Max Super Speciality Hospital were cited at 7,000 rupees to 11,500 rupees a day. Nearby 3-star hotels were around 2,100 to 3,500 rupees a night. The committee argues that such differences need to be addressed, and the issue goes beyond the cost of a hospital room. The panel cited National Sample Survey data for January to December 2025. The average cost of hospitalization was around 6,631 rupees in government hospitals. In private hospitals, it was more than 50,500 rupees. That's a difference of more than 7 times. The gap is also stark when it comes to childbirth. Average out-of-pocket expenditure for around 2,299 rupees in public healthcare facilities compared with approximately 37,630 rupees in private facilities. The committee has linked high private healthcare costs to concerns over excessive billing, unnecessary diagnostic tests, and high charges for routine procedures. But the panel is proposing more than just a cap on room rates. It wants standardized package prices for common medical and surgical procedures as well. That means patients should ideally know the total cost upfront, including things such as the surgeon's fee, diagnostics, consumables, and standard post-operative care. For complex or prolonged treatments, hospitals should provide patients with a comprehensive and legally binding cost estimate before treatment begins. The panel has also proposed financial navigators who could help patients understand treatment cost, insurance coverage, and possible financial assistance. So what does this mean for patients? Well, if the recommendation is indeed implemented, one of the biggest changes could be greater predictability in hospital bills. Patients would have a clearer idea of what a room should cost and, more broadly, what common procedures are likely to cost. But there is an important caveat here. The 3-star hotel benchmark is currently a parliamentary committee recommendation. It does not automatically mean that private hospitals will immediately have to change their prices. For that to happen, the government would need to decide how to implement those recommendations and what specific rules would apply. The panel has also said that controlling private healthcare costs cannot be the only solution. It has recommended expanding government hospital capacity, including more beds and specialist doctors. The logic is this: if public hospitals have enough capacity and offer affordable treatment, patients would have less dependence on expensive private healthcare. Ultimately, the committee's larger argument is about transparency and affordability. A hospital bill should not come as a surprise after treatment is over. And for patients, knowing the price of a room, a procedure, and the likely total cost before treatment begins could be just as important as the treatment itself.